I'm going to give a talk on the physical exam from A to Z. All right, review some interesting physical findings, some unusual external presentations of systemic diseases, and your accuracy. A is for amyloidosis. This is amyloidosis of the tongue. Very classic amyloidosis. It's a big infiltrated tongue, and there's a lot of things that can give you a big tongue. Amyloidosis, hypothyroidism, cancers, angioedema. So this tongue is crenulated. So a crenula is like the top of a castle. You know, on top of the castle. I don't. This version doesn't have a picture of a crenulum, but that's where you shoot the arrows down. And what happens is the tongue gets so infiltrated, it pushes on the inside of the teeth. So, and we'll make this talk available electronically, so you can have the pictures and stuff. So anyway, so that's amyloidosis. Primary amyloid, systemic amyloid, about 30 or 40% of the patients will have something external. They'll have nodules, ecchymosis, pinch purpura, or a big tongue. This is Bullous pemphigoid. Now, it's a common autoimmune subdermal blistering disease. Blisters are tense and intact. To remember pemphigus versus pemphigoid, pemphigoid is full thickness blisters. Pemphigus pop very easily. So, and it's autoimmune to the basement membrane. You can see them in paraneoplastic. You used to get, in the pre-steroidal era, people would get cicatricial or scarring pemphigoid in their eyes, and they'd get the blisters around their eyes, and they'd end up blind with these nasty-looking eyes. The word pemphigus means bubble, and again, pemphigus is pops versus pemphigoid, which is full thickness. You don't want to go around pushing. They have a thing called Nikolsky sign, where you push on a blister and it spreads. You never want to do that because it just makes the thing bigger. Oh, look, Nikolsky sign. Wow, thanks. So don't do that. There's paraneoplastic pemphigus. You can see the blisters are popped on the inside of the mouth. B is also for, there's a bonus B. Anyone know what this one is? Call it out. Black hairy tongue. I guarantee in a week on service, you will see this if you look. I look in every patient. I love the mouth exam. I don't know why, mostly because no one does it. You can't put ultrasound on it. But so the mouth exam is fascinating. Unusual in this case is the patient has teeth. Generally, they don't have teeth. It's a nursing home patient who smokes and eats a soft diet and doesn't brush their mouth. And the papilla get really long and stained and gross. And I guarantee if you look in your patient, any nursing home patient, if you look in your mouth, you're going to see this. And the treatment is scraping. You got to scrape it with a brush. It's hydrogen peroxide. And the patients like it much better because that does not taste good, I guarantee it. If you don't want